Here is a step-by-step guide to tummy tuck surgery or lipo-abdominoplasty. Once you know what all you need in your body to change, you have zeroed in on the surgeon and the place of the surgery, and you decide on the date. And we always have some preparation time where we do surgical scrub and other things, markings just before the surgery. And if you have any doubt, any anxiety, please feel free to discuss with your surgeon. You should enter the operation theater as an educated patient with no anxiety. Some amount of tension and anxiety is okay to have, but you should have most of your doubts cleared, and both you and your surgeon should be on the same page. Then we proceed on to the procedure, and the anesthesia is given either through epidural anesthesia or through general anesthesia. And then we first do liposuction, that is, we remove off excess fat. It's an art of contouring your abdomen. It helps in two ways. It removes excess fat, and it also mobilizes the skin for us to remove as much skin as possible safely. Then I remove the excess skin in the lower this one, and through a line which is similar to your C-section scar. It will be longer in length, but it is more or less in the same place or lower. And then we go through a layer called suprascarpus layer, meaning there are multiple layers in the abdominal wall, and we leave the bottommost layer on the muscle intact so that it keeps the blood supply, lymphatics intact, and the healing is very fast when we do in this technique. And then we mobilize all the way to the chest wall, and we assess how much muscle is loose, how much gap is there, and I go on tightening it with many times with the help of endoscopic equipment and lighted retractors like that, and we go on tightening as much as necessary. If there are any hernias in the belly button or around the belly button, that also is repaired. Usually I do a technique called pre-peritoneal repair, and then we pull the apron of skin down and trim off excess and artistically suture the skin to the new line, which will be very much inside the bikini line. And then we skeletonize your belly button and reposition it into proper place. And shape of the belly button, we have a few choices like round, vertical, oval, V, few choices. And then we do not put any drain tubes when we do abdominoplasty, because we are doing this suprascarpus technique. And once it is done, then you are wheeled off to your room where you recover comfortably, and by evening you are asked to walk a few steps, few meters, so that we keep the feet circulation and other things intact. When you do like this, you may find that there is little bit of tightness in the abdomen, and it may be little uncomfortable to get out of and get into the bed. Apart from this, there is no other issue. You will be feeling little tight in the abdominal area, that's all. So the same evening, after you are allowed to eat light dinner, you are made to walk a few steps again, and we help you get out of the bed and take these first few steps, and afterwards you are comfortable taking a small walk in the hospital premises only. And after that you go home usually the next day morning, or if you are from outstation or from out of the country, you will be in a post-operative care facility or a partnered home which will be close by. And this initial few days of after tummy tuck, you will be feeling that abdomen is tight. You may end up walking with a little forward bend, but that's all right. In a couple of days you will get adjusted to it. And climbing stairs and climbing downstairs is allowed from 4th or 5th day. You should not be putting cross-legged or sit on the floor for the first 2 to 3 weeks. After that you can do. And I always suggest that you sit with a straight back or lie down or keep walking. And sitting with crouching forward is not a good posture after tummy tuck. It helps to keep a thigh pillow, that is a pillow under the thigh, so that the pressure on the suture line is less. So this is the initial recovery period, and at the end of 1 week, most of the swelling starts reducing that point, and gradually it goes off. It takes anywhere between 6 to 8 weeks for most of the swelling to go and tummy to take a good shape. By this time, like, you would have been back in your exercise and diet regime from the 3rd week itself, and that helps in accelerating your journey to get a proper, healthy, good physique. and throughout the procedure care is taken to prevent complications and adverse effects which are very much preventable, and care is taken and attention to detail not only in the surgery, in the journey of you through your tummy tuck procedure is given lot of attention to detail, and that makes the process a pleasant one.